Varicose veins are quite common among women and men. They can be painful and unsightly, caused by a variety of things, including age and heredity. Regardless, though, of how you get them, there are many people who simply want to get rid of them. And joining me this morning to explain just how to accomplish that, Dr. Jeff Silber. He's from Riverside Radiology Interventional Associates. That's a hard word to say, Jeff. It's welcome. Nice to have you here.
Thank you very much. Nice to be here.
We're going to talk about varicose veins, but we're not talking about those surface spider veins that show up on many people's legs. This is something more serious.
Yes, it is.
What is EVLT?
Endovenous laser therapy is inside the vein using a laser to seal a large branch called the saphenous vein that's abnormally supplying increased pressure to the leg, which can cause a lot of pain. And
this is why we call it EVLT, because it has a very long name. Is this serious? Physically, can it cause more harm to the circulatory system if left untreated?
Many of the patients will go on to develop ulcerations, but usually the pain symptoms are enough to get them in to see somebody before that happens.
What kind of pain do they experience, doctor?
When you're on your feet, it's a dull, aching pain that becomes more severe, and then cramping to the point that they elevate their legs many times during the day, and then it progresses.
So this is a serious thing as opposed to spider veins. People will have pain, and that's when they'll know that they really need to see a specialist for this.
Absolutely.
Now, in days gone by, and I know this happened to my mother too, they called it stripping of the veins, which is a serious, and it was a kind of a complicated procedure. So how now do you take care of these types of vein issues?
Instead of stripping it from the outside that would require incisions to remove the vein, we use ultrasound to see the vein in the calf and then send a very small catheter about the size of a tip of a pencil all the way up to the top of the thigh, and through that catheter are able to seal it shut with a laser.
Would you call this minimally invasive then?
Yes, I would.
Does that mean that it's easier to go through pain-wise and recovery time?
Absolutely. It's very simple and straightforward so that people can get back to their normal lives right away that day, and after 7 days can resume everything, including heavy lifting.
And the pain's gone?
And the pain's gone. That's
got to be a relief for these folks.
Absolutely.
I mean, that has to be just simple walking and sitting and things. I know from my mom's case, it was very uncomfortable for her.
The patients are ecstatic. After 7 days, when they take the hose off, they're amazed at how they don't have pain anymore.
Okay, but then do they have to do this again? Could someone develop it in another leg, another vein?
There is a possibility. About 1% of patients will develop a very small, similar vessel over the next 5 to 10 years, and that's usually treatable with a injection, or if it's a big enough vessel, we could use the laser again.
Are we talking only women? I know you said women and men, but from my experience, it is mostly women who this affects.
We see 25% men, and oftentimes those cases are a little bit worse because they'll tend to let it go longer, not thinking that's something that would affect them as well.
Okay, so why do women get it more than men?
The risk factors will include pregnancy, feminine hormones, and family history as the three biggest, and 2 of the 3 are unique to women.
Yeah, that's right. That only happens to us. Lucky us. But for men who get it, what happens there?
The family history plays a big role, or if their work requires a lot of heavy lifting and being on their feet, over the years of doing that, it can be a real problem.
Okay, now do you need a physician's referral, or can people just come to you on their own, doctor?
People can come and see us for consultation, and we welcome that, but we see a large majority of our patients as physician consultations.
So how does someone know then if they're a candidate to come to see you?
It would be somebody who had pain when they're on their feet for a long period of time, who develops increasing pain and associates that with visualizing varicosities, but the pain is not actually at the varicose vein site, it's deeper inside the muscles.
So they should come to see you, and then how long does it take before you can perform this type of surgery on them, or procedure, because it's really not a surgery?
Well, the initial evaluation will help us determine if they need an ultrasound to look for this vein, which is very easy to find, and show that it's going the wrong way. And then we try and treat it conservatively if it's relatively minor, and then if not, we go ahead with the procedure, which is relatively quick and takes under an hour.
Very interesting, and so much easier than it used to be. Dr. Silber, it's a pleasure to have you here. And we've had your phone number, too, if folks want to contact you if they have any questions about this.
Well, thank you very much. I appreciate that.
Thanks.